Welcome, I'm Dr. Leanne Brady, and in this short video segment, I'm going to talk about and demonstrate a putty wash diagnostic impression technique. Using a putty wash technique has several advantages over traditional alginate impression material. One of the first advantages is our ability to pour multiple models from the same impression without distortion or damage to the accuracy of the model we receive. These new models can be poured immediately or can be poured over a period of months according to the manufacturer's recommendations. Specifically, when I think about occlusion, having a putty wash impression has value, as I may originally take them purely for diagnostic purposes and want to keep an archival set of models. I'll then want another set of models on which to make an appliance, potentially a third or fourth set of models in which to do a trial equilibration or send to the lab for a diagnostic wax up. All of this can be now accomplished without taking new impressions for the patient. Tray setup, you would like to get out the putty portion of your Flexitime Easy Putty, and you need equal scoops of both the base and the catalyst, as well as the light body component or correct flow of the Flexitime Easy Putty system. What you want to do with your correct flow is you would like to either completely remove the tip, the yellow tip, as you will see later in this video, or cut it to increase the flow rate of the material for this particular technique. With your putty, you're going to have equal amounts of both the base and the catalyst. It is very important to measure these out precisely so that your setting times will match what the manufacturer tells you to expect. You're going to now thoroughly mix this material. You do want to incorporate it completely so that you do not see streaks or stripes of the different colors. This happens to be Flexitime Easy Putty by Heraeus, and you'll see that it's purple and gray, and I'm going to continue to mix or knead. I actually would call this more of a kneading motion, and this is real time in my palm until it is totally monochromatic and I don't see any stripes. You can now either roll it into a hot dog shape or a ball because you're going to form it into the disposable tray that you previously sized. You actually do want to create a form that looks just like an impression. So I'm sizing it so that it actually rises up at the palate. I'm creating basically a channel with my thumb for where the indentation will be for the occlusal tables of the teeth. Now that our tray is loaded, we're going to take the loaded tray to the mouth. Whenever we insert a tray in the mouth, we're going to seat it first at the distal most tooth, and then we're going to roll the tray to the anterior. We're going to want to pull the patient's lip over the tray to create the vestibule, and then we want to loosen the tray significantly by wiggling it back and forth, up and down, and creating space for the light body material we will now be injecting on top of the putty. In this demo, the tip is off of the injection syringe and we are filling the occlusal tables, and then I will score back and forth across the palate, generously filling with light body VPS material. The tray, now loaded with light body, is brought back to the mouth. Again, it is seated starting at the most distal tooth and rolled to the anterior. The lip is pulled down over the tray and border molded, similar to the way we would do an impression for removable prosthesis. And now we're simply going to hold the tray in place for the full set time of the material. When you've reached this full set time, we're going to remove the impression. I have the patient close and then put my finger as far back to the distal as I can until I feel it release. I feel the suction let go. And I go back and forth from side to side, making sure that it's loose. And as soon as it's loose, it will pop right out of the patient's mouth.